Hi, Mike Gibson, Bob Applegate, coming to you live from SCAI 2015. Bob, talk to us about the Unbroken Hearts Initiative.
Sure, Mike. This is a patient-oriented campaign that SCAI has developed in order to take stories from patients that have suffered some form of heart attack, heart disease, and tell the story in their own words about what it felt like to go through this whole process, the care they received, and at the same time allow them to partner with a physician and tell the story from the physician's side. So it's really kind of highlighting what interventional cardiology is all about. And I think, we now are all talking about what a patient experience is, and we hope this is going to be a great way to not only, provide some very moving stories. I think we can talk about that in a minute. They really are. And how that can really help other people understand that it's just normal people, who end up with these heart problems, and maybe something that can help somebody else recognize some warning signs or, identify a problem before it starts.
Well, you have something like Seconds Count, which is a little more informational. It's information, it's data, but storytelling and connecting emotionally is such a powerful way to change human behavior, and I think that's part of the mission of this initiative.
Yeah, absolutely. 2 nights ago we had a firefighter from Winston-Salem. We had an IT, sort of specialist from the Bay Area in Northern California, both of whom actually, believe it or not, had no prior heart disease. At the age of 47 were struck down. Both of them had a near-death experience.
And a real near-death experience with the whole thing?
Absolutely. Yeah. The firefighter, who is my patient actually, had a VF arrest in the emergency room after having an anterior STEMI identified, was immediately resuscitated, defibrillated in the ED, taken up to the cath lab, had his LAD open, and is back to work as a full-time firefighter. Curtis, who was the IT worker, probably had a biventricular Takotsubo with a VF arrest, had head trauma, chest trauma, was in the hospital for almost 30 days, but went through a series of really miraculous, procedures designed to support his heart, support his body. Is now able to see his 1-year-old son begin to grow up. I mean, it's both incredibly compelling stories that I think moved everybody in the audience, physicians, lay people alike. It was great.
Well, people who have true near-death experiences are often transformed by the experience, and it can be a very powerful teaching vehicle for everybody else. A lot of times people think, oh, a heart attack means that you just fell down and went unconscious. And it's important to educate them about some of the more atypical and subtle signs and symptoms of the whole syndrome.
Yeah, no, indeed. And, to Tony's credit, the firefighter, he actually is a first responder.
Right.
So is somebody who is used to, being on a scene where somebody is, having a threatened heart attack and needs to go through the steps. And to his credit, and he gave a ton of credit to his own paramedic group, who recognized this, immediately got him aspirin and got him to the emergency department.
Right.
So, and Tony now is incredibly thankful.
Sure.
Talking about the transformation, Curtis said that he's looked at life differently now. He said he was on 100% adrenaline, go all the time, and now he recognizes it's so important to take time to see his son grow up, to do things in life that are meaningful to him in a way that's just not either action or job oriented. So
that's good. Probably a few interventional cardiologists could use that lesson too.
It was ironic that I'm sitting there listening to him say these things, and I'm thinking exactly the same thing. Please don't make that be the event that allows me to to see the light. But, these stories, I think you hit it on the head, are not only compelling, but sometimes in order to move the needle on how people perceive their own health, they need an inspirational event.
Right.
And for these two people, unquestionably, those events had done that. And I think anybody who sees this story, their stories on Unbroken Heart, will really have that same appeal.
Well, I think, if you speak from the heart, even if you had a broken heart, that's the things that change people's hearts and behaviors.
Yeah.
Absolutely. Bob, thanks so much for coming by today.
Thanks, Mike.
All right. And thanks to all of you for joining us here from SCAI 2015.